via our live stream and get the day underway. So welcome everybody here. My name is Fiona Armstrong. I'm the founder and Executive Director of the Climate and Health Alliance, and I'm very pleased to welcome you here to our happy home at Ross House. We have an office here on the 4th floor next to our friends from Beyond Zero Emissions. This is the first event that we've had here since we moved in June, so it's great to have you all here. I want to acknowledge the members of the CAHA board who are here today, members of various committees, our staff, volunteers, members and friends of CAHA, and our sponsors. I'd just like to cover some housekeeping. The toilets are at the far end of the corridor along this way. Just be mindful of the fact that the walls don't actually go to the ceiling, so it's kind of like an open space. So there's not that many people in today, but don't shout or have loud conversations as you're going down there. I also want to acknowledge the traditional owners of the land on which we meet, the Wurundjeri people from the Kulin Nation, and acknowledge the example that they set in environmental protection, sustainable resource management, stewardship of land and protection of other species. So, climate change is a health issue. What will it take to get action to respond? Our symposiums today is intended to provide an opportunity for people to come together to share and connect and build the network and community of practice around climate change and health, and to find opportunities for collaboration to inspire and accelerated action to tackle the threat of climate change to human health. We're going to hear a series of lightning talks on the latest policy, advocacy, research and communications on climate change and health. Our objectives for the day are about communicating on climate change and health, identifying how to frame climate change as a critical public health issue to policymakers and to media and to the wider community, to raise awareness about research, policy, advocacy initiatives on climate change and health, and the priorities and gaps that exist in that space. We're going to learn more about climate smart healthcare and generate momentum and commitments for action on climate change and health. So in the room we've got a very rich and diverse community. We've got people from the health sector, from local and state government, professional and industrial associations, research, academia, philanthropy, environmental organisations and civil society. So I want to thank you all for taking the time to come together to talk about this issue. So as I said, the agenda is to hear some lightning talks of 1 to 2 minutes on a range of topics, and for the rest of the symposium to be around sharing insights and perspectives from the floor. So it's my goal that everyone who has something to share, and I think everyone who's here has something to share, has the opportunity to do so. So we'll need to be very generous to others and mindful of the number of people and the time available, and try and keep contributions really relevant to the discussion and the objectives of the day. The program suggests that we're going to hear all our lightning talks at the start. I'm going to suggest that we cluster them a little bit, spread them a bit more throughout the session so they have the opportunity to develop conversations around them. We're going to hear from Harriet McCallum from the Lord Mayor's Charitable Foundation about the role of philanthropy in this space. Dr. Ying Zhang from the University of Sydney about how research is being used as an accountability tool in monitoring action on climate and health. Diana McDonald from Sustainability Victoria about recent research on people's understanding about the links between climate change and health. We've got Sue Cook, who will talk about developing a human health and wellbeing climate adaptation plan for Queensland. Kath O'Shea, who will talk about the work of Western Health to reduce its carbon and environmental footprint. Joe Walker on the impacts of climate change on rural and remote communities, and Michelle Isles on some work to engage health stakeholders with a climate solutions frame in talking about climate change and health. So I'm going to call on these people in the following order. Harriet, then Ying, then Diana, then Michelle. Then we'll have a bit of discussion, and then I'll call on Joe, then Sue, then Kath. Is there anyone that I've spoken to that I haven't mentioned yet? You're expecting to say something. Raise your hand. I encourage you all to jump in and share your own experiences and work in the discussion, with a focus on what's happening, what else is needed to keep our attention on action and momentum. Please state your name and affiliation before you speak. So based on the number of people in the room, it's likely that we'll only have about 1 minute each, so please be to the point. I'd also like to advise that Melissa Sweet from croaky.org is here, and she'll be writing a report on the day, so please let her know if you don't want to be quoted. We'd also like to capture the insights from our discussion to inform our work, so you'll see that there's some butcher's paper up on the wall referring to the various discussion themes. Some of the CAHA staff and volunteers are going to be capturing ideas and contributions on post-it notes and posting them to the relevant theme. We encourage you to help out by doing the same so that we've got a good record of the discussions and some prompts to help us follow up later. So feel free to jump up during the discussion and pop those up there. You'll also see that we've got a microphone and camera set up, so we're live streaming via Facebook. Such as the interest in the discussion, we're endeavouring to make it possible for those who are unable to attend to have access to the discussion. If you don't wish to appear in the live stream, please let us know, and if you don't wish your comments to be broadcast, please let us know, and we can mute temporarily. You'll also see that we've provided you with a piece of paper with the symposium question. What will it take to get action to respond? And those of you in the second tier, if you haven't got one, or you have, they're on your chairs. Okay, great. We'd like you to complete these as a further input to our collective understanding and to declare your own commitment to action. We're also going to have a photo booth over here in the break in the corner, where we're asking if you will have your photo taken and with your permission, prepare a meme for social media with your image and the solution that you propose to promote the actions that this community sees as necessary. So Danielle, where are you, Danielle, who's taking photos, will be doing this in the break and after the symposium. So if you're willing to declare yourself a Climate and Health champion, please attend the photo booth and talk to Danielle. So without further ado, I would like to call on Harriet McCallum to kick our discussions off. Thank you, Harriet. Yes, and before we begin, can I also ask that people turn off their mobile phones? And can we have a microphone for Harriet, please? We should have a roving mic.
All right. Thanks, Fiona, and thank you for having me. Fiona just said to me she didn't know where to place me, which is not unusual for us as philanthropy coming into this space. So just very quickly, Lord Mayor's Charitable Foundation is working quite extensively on the issue of climate change. We have our Environment and Sustainability impact area and my impact area, Healthy and Resilient Communities. In the Environment and Sustainability impact area, we're looking at supporting the transition to a low carbon economy, protecting our food and water systems. And in my area, there's a strong focus on supporting communities to build resilience in the face of climate change, with a very specific focus around increasing awareness and understanding of the health impacts of climate change, which is how we've come to fund CAHA over the last few years. And it's good to see many of our other grant partners in the room as well. Broadly speaking, in terms of the health outcomes that we look for in our funding is to continually look at issues of inequity, structural disadvantage and the potential for systems change. Philanthropy needs to be really smart about how we use our money. It's a drop in the ocean to government dollars, and we do this by using the whole philanthropic toolkit. We don't just grant. Our grant partners will know that we do get quite involved. So how do we do this? In speaking about how we use our money, we assess the work that comes into us about not just maintaining the status quo, that we need to progress an issue and that we need to support people who are prepared to take on challenges in a new way. Obviously, when it comes to health and climate change, there's not really a status quo. There's not enough being done in Australia, so progress is there to be taken. How do we do this? We fund the building of an evidence base and policy guidance. we support partnerships and we bring people together. I won't go into it, but we're delivering a Hotspots initiative at the moment, which I've developed in consultation with VCOS, EMB and DHHS, and some not-for-profit partners as well, in terms of supporting health and community service organisations in suburbs of Melbourne that are literally hotter during heatwave, to work together to address the health impacts that disproportionately affect people on low incomes in those communities. I'll be leaving this meeting today to go to a meeting out in the western suburbs to talk about this initiative. We back innovation, as I've already mentioned, and new ways of thinking or doing, right from the grassroots organisations right up to peak bodies or research institutions. We're in a privileged position where we can work nimbly across sectors, across government, not-for-profit and academia, and we do this regularly. That's probably enough. So,
Wonderful.
Yeah.
Thanks. Okay, can I now call on Diana? Oh, sorry, I'm reading my notes incorrectly. You're right, Ning, take it away.
Good morning, everyone. I'm Yin Zhang from School of Public Health, University of Sydney. It's a great pleasure to be here to talk about the exciting project to publish the first Australian national report to track progress on climate change and health. I co-lead this project with Professor Popex at Macquarie University. Following last year's release of the Lancet Countdown Global Report on Climate Change and Health, we've been working with Medical Journal of Australia and Lancet Countdown to present 41 indicators across 5 climate change areas, including the health impact, adaptation, mitigation, finance, and public political engagement. So overall, we have found that Australia lags behind other comparable high-income countries in many of the indicators. But we have also identified opportunities and capacities for climate and health action in Australia in the coming years. So this year's Australian policy brief will mainly based on the key findings of the Australian Countdown paper, and calling for policies and actions to address important issues such as climate-sensitive infectious diseases and mental health problems related to climate disasters, and also the promotion of more active transportation and so on. So sorry, I cannot share more findings here today. So we hope to get the paper published later this year, just before the COP24 conference in Poland. So watch this space. Thank you.
Hello, I'm Diana McDonald from Sustainability Victoria. So about a year or so ago, we did statewide research that showed that people know climate change exists, they're concerned about it, and they really want action across all sectors. We also had a few other questions in the survey though that showed that they weren't really making the link between climate change and health. And when we asked them to do a priority ranking of the important issues for the state, health was first, climate change was last. So it's clear they weren't making the connection. So we've recently done some qualitative research to see how do they join the dots. The short answer is they don't. They need to be stepped through the journey, step by step, with explicit and concrete evidence along the way. Once they get there, it's a really powerful message. They see that it's, they totally get it, it's logical. Once you take them there, they can work back and see the connections. They really see it's personal, they see it's really important, it makes them want to engage more, it makes them want to act, and they're also indignant saying, why aren't we being told about this? So we just want to work to take that research further, see how we can use it.
Oh, I'm sorry, I hadn't seen you. Welcome. Very nice to see you.
Good morning, everyone. So I'm Michelle Isles from Climate Works Australia, and we work to provide a vision for net zero emissions Australia. We deliver a national education engagement program called Generation Yes, and that helps to build the capacity of organisations across Australia in their diversity to think about the solutions, work on the solutions, and also we're interested in activating voices, because we know from our previous speakers we need to create more momentum and we need to have more leaders across the diversity of sectors talking about the solutions to climate change. So we partnered with the support of the Lord Mayor's Charitable Foundation with CAHA to do some initial research to understand how health organisations were engaging around climate change solutions. What we want to test is the language, the language that we might be using with business and others won't necessarily resonate with your organisations, your suppliers, your partners. So we sent out a national survey, and then we worked with some of you in the room to do a bit more detailed testing. So how are you actually talking about solutions? What are you working on? How does it resonate? How are audiences responding? So we're just collating all of that data and great information now. We've got lots of resources up on the Generation Yes website that show case studies on some of the solutions, and yeah, we look forward to sharing some of that research, and I think there'll be some great recommendations that we can take forward. Thank you.
Thank you very much. So, philanthropy, research and communications are some of the things that we've heard about. Do we have questions or comments on any of those topics? And I'll pass the microphone around, and we'll now just use this on the floor and swivel the camera around to capture those comments. But please have the microphone when you speak and state your name and your affiliation before you do.
I'm Mary Cannon. I'm on public health committee of the Australian College of Emergency Medicine. We seem to, the surprise of some of us, to have a cohort, I'm not sure how large it is, who hasn't joined the dots of this, most dismissively regarded as probably the most pressing health issue of the next generation, if not next 2 years. I would be very interested to learn what language we should be using in university-educated health professionals who, I'm not sure what the barriers are, so I'm very interested in what language we should be using to reduce those barriers. If we've got to appeal to the wider community, I'm not sure how we can. If I can't, we're obviously using one language, there's a small, I presume, number of our government who are very against our organisation getting involved, and we need to overcome the barriers in communication about that.
Diana, would you like to respond?
Yes, it's not really about language, but just in terms of our health, in the research that we did, and also in research that I've read that's been done in America, it's in terms of the topics and how you relate climate change to health. They tested a whole lot of different, 8 different essays, all covering a different aspect of health and climate change. And the one that had the most resonance is when you tie back climate change to the impacts of quality of food and water, like the basics. So, and our research showed that as well, that kind of really resonated with people. So that's kind of not about language, but it's about a way to engage on something where they can see the links and that it means a lot to them.
I think we also found that the language and framing can make a difference. So depending on the context, so we worked with hospitals and research organisations, smaller health organisations. There are different ways in which they are going to and want to engage with their communities, so we can feed in some of that. But I'd also echo Dana's comments that it's obviously about the topics, and we very much focus on the solutions, what it actually looks like for the healthcare organisation and what it looks like for communities, so the health and wellbeing outcomes are really key.
Hi everybody, I'm Peter Sainsbury. I'm for the next 2 hours president of CAHA. I just wanted to just provide a little bit of information on Marianne's question. The medical teams of Australia and New Zealand commissioned a year or more ago some work to develop a curriculum for medical students regarding climate change and health, but they took that remit broad. It is focused on that, but it's a broader remit, and they've considered health professional education generally. So just to let people know that there has been some work regarding the inclusion of climate change issues into health professional education. I can provide links. I wasn't involved, but I can provide links to people who are involved with that if anyone's interested.
I guess one question is whether that's enough, isn't it? I mean, do they have this information, but do they then know how to communicate it to their peers, to their patients, to their community? There's someone in the room I know who's got an interest in health professional curricula, and that's Trish Wortley. Did you want to make a contribution there, Trish?
Yeah, I'm Trish from Monash University, and we're integrating some climate-related learning objectives into our curriculum for nurses and midwives. And we're aiming, well, I suppose, I think it's one of the first nursing and midwifery curriculums that actually includes climate change. And it is difficult at the university level as well to convince people that this is part of our mandate. Part of the problem, I think, with health professionals is they're really educated into this biomedical model of health, which is our diagnosis, treatment, admitting and discharging, and we need to reorientate that focus towards a social model of health where we're looking at other impacts, including the influence of the environment on health.
Rebecca Patrick, you're from Deakin University. What would you like to contribute in this space?
Thanks. Hi. For the next 2 hours, I'm the Vice President of the Climate and Health Alliance, and welcome everyone. It's lovely to see so many people here today. So, I'm also the organisational representative for the Health, Nature, Sustainability Research Group at Deakin. At Deakin, we, since 2012, in our Health Sciences undergraduate course, have run a Health and Sustainability major, so preparing our undergraduate students and health professionals to look at the issues of climate change and health. And picking up on what you were saying there, we're still trying to convince the university that we need to maintain that major for health professionals, because the question keeps coming up. So what jobs are these graduates going to have that explicitly demonstrate that that's the work they're going to do now and into the future? So we've gone about looking at job descriptions and trying to map the sorts of competencies and the sorts of jobs that our graduates will be moving into the space. So part of the cycle of need here is that in constructing our job descriptions in the field, that there's some explicit links to the sorts of tasks that health professionals will be addressing climate and health as part of their core business. Thanks, Fiona.
We get lots of inquiries here at the Climate and Health Alliance about what jobs people might apply for in climate change and health. They all want to come and work for us, but we have to give them the bad news. Not that many jobs around here. Jamie.
Thanks, I'm Jamie Maxwell. I'm the environmental leader at RSCGP for the Specific Interest Group, and also I have done research in climate change and health in the curriculum and was part of the Medical Dean's Working Group. I did some research early on about how to communicate, how GPs who are active in climate change advocacy communicate their messages to their colleagues and patients, which is something that I think is quite, it is sort of a core question if we're talking about health professionals and getting them on board, because a lot of health professionals see their core business as treating their patients, and I think one of the main challenges for educating health professionals is trying to link it to their core practice, and a lot of health professionals the GPs in the research felt that it was often inappropriate to bring up climate change and sustainability in the clinical consultation, and so exploring that further and trying to work out how to link that in the context of quite an individual focused health system is a challenge, and particularly one that's focused on curative care rather than preventative care, because a lot of climate change and health is more about prevention, emergency planning, and resource allocation, all those sorts of things. So that was one of the main barriers for clinicians to engage in climate change and health, and the main ways that seemed to resonate for people who weren't very interested in the environmental context but more interested in the health context was focusing on organisational sustainability. But yeah, I could talk, if anyone's interested, wants to talk more about the medical dean stuff or our stuff at the College of General Practice doing similar curriculum work, or at Melbourne Uni, happy to talk. So.
Amanda?
Amanda Adrian, I'm on the board of CAHA. I'm interested in the level of discourse between the social determinants of health dialogue and the climate change and health dialogue, because it seems to me that there is a very strong affinity between the two, and it really does strike me that I'm not hearing those words, and whether it's now out of date or inappropriate to use them, I don't know, but I wouldn't mind some clarification.
I'm guessing Tim Woodruff, Doctors Reform Society, and maybe Joe Walker might have something to contribute there.
Some decades ago, I went through medical school and we hadn't heard of climate change and we hadn't heard of the social determinants of health. The health system was basically constructed on individual care at the time. Over the years, medical students have been exposed increasingly to a lot about the social determinants of health. And talking to some younger doctors, the impression I get is that with that education, which goes right through the medical curriculum in many places, quite good, about a third of medicos are, and always will be, completely focused on the individual care type of medicine. It won't change. Nothing we can do can change that. And then there's about a third who take it on board very seriously and see that right through. And then there's the swingers, of course, the ones that this kind of group and things that everybody's talking about, they're the ones that can be influenced. And I would say that the same is likely to happen as we get increasing education about the health effects of climate change. There'll be some who just don't want to know. There'll be plenty, increasingly plenty who are picking up on it. How you do it in reference to what whoever spoke before, in the individual consultation, I'm not quite sure from the RACGP, because the individual consultation is going to remain basically that. But the organisation, at the organisational level, I think there's ample opportunity to move on.
Joe Walker. And if there are any students in the room, it would be interesting to hear from them.
I'm Jo Walker. I'm wearing two hats today, National Rural Health Alliance and the Australian Health Promotion Association. So I'm not sure who comes from the health background per se, but I'm just going to make an assumption that you're all aware of the Commission of Social Determinants of Health. That was 2008, so it's a decade old. So the social determinants has been, as we all know, like 17 years to get any research into action on the ground. So social determinants has been longer. I mean, it's actually been around since Alma-Ata in 1978. And so we're still kind of trying to get that message around the determinants of health, particularly around social determinants of health, education, transport, etc. are an issue. But what's gone off the radar is all of those environmental determinants that started the public health movement off in the beginning. So now what's happening is this, we're trying to bring everybody back into the tent and say we need to revisit those environmental determinants as well as the social determinants, so that we're now talking about ecological determinants of health. The Canadians have already started to do a lot of work on this, and they've actually got an ecological determinants of health framework. So in terms of that language, that already exists. I think also with my health promotion hat on, actually I've got a copy of a journal, the Australian Health Promotion Journal, in my bag here. Actually, Rebecca, there's an article that you wrote in that. In 2011, that was a special issue that was around climate change and health. Now, in my professional group, that language has not developed any further since 2011, and I find that really astounding. So I think that we have an opportunity with the Sustainable Development Goals to actually link in health promotion, public health, because the Sustainable Development Goals are a massive public health framework. Literally everything on there has a health impact. So it's not just about the climate change things, it's about getting the linkages and the languages. But I think that we are still a fair way off from getting people even on the first step around social determinacy.
Joe, while you've still got the microphone, just putting your NRHA or policy hat on, do you want to just comment on to what extent you're seeing those social determinants of health, ecological determinants of health, and the SDGs being picked up in policy?
With our rural hat on, very segmented, very fragmented. Just a classic example of a phone call from Jed Kearney's office yesterday about the intergenerational welfare inquiry that's going on at the moment. The real disconnect between the employment sector, between the education, between health. These health in all policies, the concepts, they just don't exist. So when we're going in with a rural hat on, we're talking to siloed groups about agriculture. And even within those systems, you're talking about water management, soil conservation, it's all separate, it's not all connected. And I think it's deliberate that they've set it up to be so disconnected, and so piecemeal with the programs that they're putting together. It's really hard to join the dots to find out ecologically how they're all actually connecting. Yeah. So from a policy perspective, I don't see very much change for over 10 years.
At the national level? Yeah, okay. I'm going to call on Catherine, then Peter Sainsbury, and then I'm going to ask Aileen and perhaps Frank, who know a bit about the social and ecological model of health, and then go back to Ying. And if there are other people in the queue, let me know, and can someone help me to keep a tally of what hands are in the air as well, so you're not continually putting your hand up and down when I'm looking somewhere else. Catherine Middleton.
So I'm Catherine Middleton. I'm one of the Climate Change and Health project coordinators of the Australian Medical Students Association. In terms of how the climate change and health topic is being integrated into our education, I can only really speak anecdotally. I know that the public health sort of the curriculum is very well integrated into our education, and from my personal perspective, it seems like the climate change and health aspect of it hasn't permeated very well at all, and for me it doesn't quite make sense as to why it hasn't really made its way through, especially if you frame it as the most fundamental kind of public health prevention strategy we can take is action on climate change, especially when we have such focus on primary prevention in this space of public health. It just seems illogical, and I think framing it that way is probably one of the most logical ways to get it to integrate into our curriculum. My personal thoughts on how to communicate to the individual as to why they should get involved in climate change and health sort of mitigation strategies is to communicate to the co-benefits of personal action that would have benefits to people's health and the environment. So just like active transport, which can benefit people's mental health, can decrease carbon emissions because they're using, active transport. And I think if we can communicate to those sorts of things, that might be a way in general practice. But as far as education goes, I think, communicating it as a primary health prevention topic is the way to go about it, and it doesn't need a particularly large change in the curriculum that's already there. Like public health is already in our curriculum. It's just a component that isn't really taught at the moment.
Thanks, Catherine. Peter Sainsbury.
Thanks. I just want to go back to Amanda's question about the link between social and environmental determinants. Fundamentally, the social determinants of health refer to those influences on health that are determined socially through the social structures and processes that we establish collectively. That's not always very clearly explained. When you see it in that context, air pollution, climate change are social determinants of health. And we should be promoting this very vigorously. These are decisions that we choose to make to pollute the atmosphere, to increase the global temperatures. So those environmental determinants of health are social determinants of health.
Great, thank you. And can we take the microphone down to Eileen and Frank from Coomera Regional Health Service, who can share. You can fight over the microphone.
Yeah, so I think that in one of the ways that we have tackled that is by very clearly coming from a health promotion perspective, where we have moved into looking at all things within our hospitals, from policies through to individual personal action around making that shift away from curative and restorative care is included, but into a more socio-ecological model where we have had people think about it right from the get-go. So integrating it into policy, integrating it into position descriptions, integrating it into the orientation when people join our hospital at interview. So by embedding it in that way, you're starting to have those conversations around the importance of making your environment sustainable. And so thinking about it in that way, you can incorporate it into a whole range and a whole stratification. So when you're interviewing, whether it's doctors or whether it's the cleaning staff that come to our facility in our small rural health setting, and they're hearing this language, they're hearing that information and understanding that it is important and that we have it as a priority area.
I don't know if I can validate much of what Eileen said, but I've been at the organisation for 2 years and I'm really the next person who's kicking the can down the road with this. But what I've observed is it's a slow process. You have to be at it continually. And at small steps, we no longer have any green waste leave the facility. So the gardening contract was such that you must leave the green waste in the facility. We've got a very proactive man chair who seem to get it and have some of this philosophy embedded and they mulch the green waste for it. So it's engaging that. I noticed from the community members that come into the organisation, they make commentary on our garden, on the chickens that are there. And it's really this backyard approach, I think, almost, that people feel comfortable in their own backyard and know what to do. And if we can create that environment, it lends to us moving in the right direction in the organisation. I know that we've still got an issue with the amount of food waste that leaves our kitchen, and we need to address that. That's a challenge for us in the future. Solar panels are about to go on the roof on the 1st of October, so we think that's a step in the right direction. But we're always looking, but it's a slow process.
So just for those people who don't know, Coomera is a regional health service in Gippsland. Do you want to just share a couple more things about, you talked about some of the things you've got planned, but just for those who don't know some of the things that you already have in place that you haven't mentioned?
Aileen may be able to expand on that, but we're a weird little organisation. Our change in direction happened with the previous CEO. Casey Hospital was built on our doorstep and lots of our services disappeared. Our surgical services, our midwifery service and any element of emerging care service that we at that time provided disappeared. And the organisation had to rethink its future. And it took about 2 years, and the direction was of promotions and community aspects. So we don't do surgery, so we don't have to put energy into that. We look at improving the health outcomes of our community well before they're sick. So it's really forced the change in our whole direction.
We might go back to Ying. We heard, Ying, that we're not seeing health in all policies, we're not seeing the social determinants of health integrated into policy. To what extent do you see projects like Lancet Countdown as providing an opportunity to hold governments accountable to monitor progress towards policy that will help us tackle climate change and health?
We do hope that the policy briefs from the Lancet Countdown project can provide precise and action-oriented policy changes in the domain. But unfortunately, because last year's recommendation from the Licensing Countdown Project for Australia hasn't been taken. For example, the recommendation to adopt a national framework to address climate change and health, which CAHA has been extremely active in this area. So we would continue the effort to lobby and advocate to policymakers to act and hopefully will bring some real changes in the society. I should mention that this year's Australian Policy Brief was written by a medical student from the Australian Medical Student Association. So the capacity building during the process of the project itself is kind of encouraging, because as teaching in the climate change and health unit at University of Sydney, one of the feedbacks from students are the messages are very depressing, very depressing. So I would like to actually spread the positive part of and opportunities for particularly resource-poor areas to change, take this opportunity. So yeah.
Thanks, Ying. Well, just on that, the framework for a national strategy on climate health and wellbeing that was CAHA led the work on, that many organisations in the room and many people have contributed to. In terms of commitments, we do have a commitment from the Australian Labor Party that if elected to government, that they would develop a national plan based on the framework that we developed. So that is a very positive outcome. We also have the support of the Greens. We've had less enthusiasm from the current government, although I would say that as Minister for Aged Care and formerly as Assistant Minister for Health, that Minister Ken Wyatt has been personally very supportive and clearly understands the links, but that hasn't gone as far as him being able to bring his colleagues along. But we did have the opportunity to present that framework at the Global Climate Action Summit in California last week, so it's interesting that there's international interest in that framework as a model and as a template for other nations. So we're kind of hoping that, like an Australian recording artist that struggles to get a contract here, that we might have a hit single overseas and then have it adopted back here. So hence the investment in the carbon emissions that it took to have that conversation internationally. I just want to come back to the conversation about health professional curricula, because that seems like a live conversation, and I just want to throw to Libby Muir, who in your former role at the Australian Nursing and Midwifery Federation were responsible for developing a curriculum for nursing and midwifery practitioners, nurses, midwives, around climate change and health, and just an observation on what you learned about what they know about climate change and health, what they want to know, and where the gaps are in their education that ANMF was seeking to fill through continuing professional development that they weren't getting in their undergrad.
So I guess before I speak, I'll acknowledge that Ros Morgan is here as well, and she was integral to the development of that training as well. One of the things that we were getting back a lot from ANMF members in Victoria was that they really wanted to know what to do. They were reinventing wheels all over the place, even within health facilities. They might be in different units in a health facility, and someone was starting from scratch where someone had already done a lot of hard yards. So there was so much momentum, and they were so keen that it was really a no-brainer. We saw that there was a need for it and people wanted to do it. So we utilised the strength of people like Ros and other people in health who are already doing a lot of work. Kath, I think, you're involved as well. Aileen, we spoke with you and got a lot of information about what people were doing, what was working, how we could help assist people to build that strength and be informed. And so from there, we've got classes running twice a year now. Ros really runs them, so I might pass over to Ros to talk about what's in them. But it's grown and expanded, and it was a huge momentum.
so glad I had this opportunity. I was busting to put my hand up, and it was just so quick. So you do need someone helping you with that, because the hands are lightning, which is a wonderful, wonderful thing. And so I want to pick up on a couple of things that have come out today. You know, the gentleman over here talking about the men in the men's shed, they've got it. We had, I think, Diana from SV speaking about, and when we've joined the gaps for people, the dots for people, they're actually quite indignant about it. And we've also had talk here from Trish about how it's only in her curriculum that she's aware of. And we've got added to that a very, very busy working environment where people are under pressure for outputs that are core values, and this isn't always seen as one. And in that environment then we have this great big topic of climate change and environmental sustainability. Well, how does that, okay, it's out there and I'm concerned about it and I'm hearing more about it through the International Council of Nurses, or maybe, you know, the work of CAHA, Global Green and Healthy Hospitals case studies. But what's that got to do with me in my everyday workplace? Or I think it's got something to do with me, but how? So how do I translate this great big topic into my everyday workplace? And that's the gap that we've needed to fill. And so we were asked to be more active personally and politically in supporting members. So how does this fit in politically? So we go big picture to small picture, because we have to have a rationale for action. So the Sustainability Development Goals, the World Health Organisation, the Paris commitments, and what's happening in Australia, the Victorian commitments. So politically there's a movement for me to be involved in this. And then the rationale, which is a little bit of the work that was being referred to with Sustainability Victoria survey. Okay, these are the health impacts. So this actually is a public health issue, and I wasn't taught that. Working with students, I'm still in clinical practice, and I'm always out there, what have you been told? The answer is consistently nothing. To the extreme of not even being taught what, you know, one of the platforms is waste, Global Green and Healthy Hospitals platform, not even being taught what clinical waste segregation is. That's an extreme deficit. So now we've got nurses who are training, and then we've got nurses, midwives and carers who have trained. And there's this massive gap in what they know. But once they do know, they're indignant, and once they do know, they need to know how to translate this into my action, because there's ladders of engagement. And if I can start with something that I can have wins in, and waste is in my hands, as I work on that ladder engagement and I have output per input and my education and exposure grows to the various aspects, I rise up that ladder of engagement and I start to look beyond my individual contribution to my collective contribution. So there's a massive gap. Nursing for the Environment has been one of the responses to try and fill that gap. There's a lot more that's needed, and there's some of the communication I hope there in my responses as well. Thank you.
Thank you very much, Ros. And I know Sarah Stewart over here from Council of Aboriginal and Torres Strait Islander Nurses and formerly Australian College of Midwives.
Yes, thank you. Can I just say thank you very much, Ros, is it? You pretty much just said what I was going to say. You've got to make it about what can I do. You've got to make it personally, because I can't stress enough from the nurses and midwives' perspective how much they've got on their plate. They're worrying about, we're telling them that they mustn't be racist anymore. We're telling them about cultural safety. We're telling them, the midwives, about how to, that they're fighting to get birthing at home. We're getting, speaking way back when I was in the College of Midwives, we're getting consultations across our desk about anything from breastfeeding through to the use of whatever. There's so much that we have to deal with, nurses and midwifery, and I'm sure doctors are the same. And so climate change, which sounds so big and unmanageable, goes right to the bottom of the list. So we've got to make it individual to the practitioners on the ground, but we've also got to be strategic about what we're doing at a national level. I think one of the things, and I really praise the ANMF for what they're doing in this space, because the ACN, the ACN, and all those organisations are way behind on this, and we've got to be strategic about our lobbying we do at a national level. So, for example, every 3 years when consultations around the undergraduate curriculum comes through with ANMAC, the Nursing and Midwifery Accreditation Council, then we need to be lobbying at those consultations to make sure that climate change is included into the standards. So we've got to be strategic, we've got to get together, we've got to be strategic. We must think about ad hoc lobbying. We've got to have a plan. And we probably, as peak organisations, for example, get together and say, right, and actually have possibly a 5 to 10 year plan. So that we look at, the nursing education standards are coming up in 2 years' time. Let's decide on our position on that. Midwifery one the year after, there's this, there's that. And so there's a number of ways we can come at it. But I think I'm rambling. I think the key is that we've actually got to be a lot more collaborative and a lot more strategic on what we're doing.
Before you hand on the microphone, Sarah, would you just talk about who you think that responsibility lies with? So who are those peak organisations that you're referring to that you think need to collaborate?
Look, I think in the nursing and midwifery space, I think it's the College of Midwives, College of Nursing, A&M Earth, CATS&M, Crown Plus, Rural Health Alliance, because we already work together across the board on all sorts of other topics. So we've already got those relationships from a nursing and midwifery perspective, but ideally we should all be working together, all the peak nursing, midwifery, medical organisations together. But someone has to put their hand up to get this going, and there is so much chatter around all sorts of other stuff going on at the moment. It's getting someone to do that.
Many of those organisations that you mentioned are members of Climate and Health Alliance. Is there a role for Climate and Health Alliance in coordinating and convening that work? Who's got their hand up? Ray Wilker.
My name is Ray Wilker. I'm an emeritus professor at Victoria University. What I've been fascinated by is listening to the way that people are speaking about the frustrations of communication on climate change, and even ways of framing the issues. And I was really struck by the sophistication of what career people were saying. But what they were speaking about was climate change from the perspective of someone who has responsibilities for systemic issues, their own organisation and broader system issues. Is that a reasonable comment? I know their work has been very systems oriented, but then there are other categories of people in the health system, such as the clinicians, who are much harder to crack in terms of getting them to engage with climate change. And that reminds me that one of the traditional ways that people in the health system have often sought to approach issues is from a population group perspective. So whether that be children, whether it be older people, whether it be Indigenous people, or whether it be people with disability. And often services are organised around population groups. Not entirely, but it's an important thing. And policy sometimes is organised around population groups. Again, it's an important thing. And just recently there was an example of that where the Green Senator, who was trying to get people with disability included in the Royal Commission into aged care, and just basically told them to bugger off because their framing of things was about people who are older, not people who had shared some health issues. So, and if you look at climate change research literature, you find that there is buried within it a population perspective. So for people with disability, the biggest issue by a squillion miles is extreme weather events. I mean, the mortality is at least double, sometimes many multiples of that, of people without disabilities in massive extreme weather events. For older people, much of the literature is around heat. So if we're conversing with people who deliver services to those population groups, is there any merit in starting from that perspective of these are the key issues in climate change that are impacting upon the people you provide your services to? I mean, it's only a partial approach, but it is one that's got a long history in health services.
Okay, I'm going to get you to pass the microphone and call on Melanie Lowe from Australian Catholic University and just continue that conversation around curricula. You might like to share what you're doing in that space. I know we had a fabulous intern, Shakira Cass, who worked with us on the Queensland Human Health and Wellbeing Climate Adaptation Plan for ACU. Share some more.
Yeah, thanks for that. So, yeah, Melanie Lowe from the Australian Catholic University. And I just wanted to add to the conversation about the key role of public health. We've heard about some of the key public health frameworks, determinants of health, ecological models of health. That's really our core business in public health. I teach both undergraduate students coming straight out of school as well as postgraduate students, and this is a core part of our curriculum, not just because it's a personal interest of mine, but talking about public health, this is the issue of our time, and so it's really important that we teach our students about everything we're talking about today, but we also teach perhaps a little bit extended beyond clinical type degrees. We do teach about advocacy, we do teach about communication, so there's other skills that health professionals and health workers in a whole range of fields will actually need for working in this space and advocating for change. And the last point I wanted to make is that just we do find that in the postgraduate pathways, a lot of the clinicians who are most passionate about this end up at public health. They end up being interested in populations and they end up studying a Master of Public Health, and this is often where they can be really galvanised to act.
John Isa from Doctors for the Environment Australia and
thank you, Fiona. So I don't need to introduce myself again. I just want to make a comment about the inclusion in the curriculum of health and climate change, because it very often depends on direction from the top. And so I just wanted to inject a note of optimism, really, because in the last few years, those bastions of medical conservatism, the medical colleges and the AMA, Victorian AMA, Australian AMA branches, have really moved in changing the way they're directing courses. And there was just recently a meeting of the Council of College Presidents who agreed that more education or more time should be spent on including climate and health and climate change in the medical curriculum. So things are really changing. The Royal Australasian College of Physicians, the surgeons and other colleges are all now developing very strong policies and statements on climate change, and these are then broadcast in their newsletters, their regular monthly articles and so forth. So it is changing, and I think we've just got to keep, one of the roles of the DEA, our organisation, is to keep at them to pursue these very strong policies. So yes, well, I think we are getting somewhere. Thank you.
Before we release the microphone, John, can I just ask a question? Policies are one thing in professional organisations and institutions. It's what happens with those policies that's important. I mean, the Australian Medical Association has had a position on climate change and health since probably around 2004. I think they did a report with the Australian Conservation Foundation pointing to the urgency. Ian Lowe is nodding, so I might throw to you to talk about that. But do you want to just make a comment about, how those can be operationalised? Because I guess what we see is that certainly through our work here at Climate and Health Alliance, we have prompted the development of a number of climate and health policies among medical and other organisations. But the existence of those policies in itself, unless there is active kind of efforts to see those embedded into policy, they remain just that, policy statements that belong to that organisation. So perhaps if you could comment on that, and then I might throw to Ian Lowe and then to the gentleman in front of you.
Yes, very, very pertinent point. I think it's a ripple effect. When you mentioned the AMA, yes, it is a very strong policy, but then the other colleges did not. And gradually, over the years, more and more colleges have developed policies, and these are then all broadcast and distributed to members. And you probably realise that surgeons in particular are very conservative, and we have a lot of trouble in spreading our message throughout the medical community. But it is happening, and the voices, the denialists, if you like, are gradually being drowned out by the flood of those who support action. So it is a slow process, but that is what happens when you're dealing with people with conservative ideas and backgrounds.
Although some surgeons get it, don't they? Little president.
Thanks. I'm Ian Lowe. I was pensioned off by Griffith University nearly 20 years ago, but I'm still active and dangerous. The DEA have been doing very good work producing posters and fact sheets for GPs, and there are individuals who have been trained through the Australian Constellation Foundation's Climate Reality Project in the medical profession who have been spreading the word among their colleagues. But it's like the old joke about how many social workers it takes to change a light bulb. Only one that the light bulb has to really want to change. There are people who clearly don't want to change. And I don't think we should underestimate the damage that's done by the reactionary rump in the Commonwealth Government, because people who don't want to change use as a prop. If the Commonwealth Government doesn't think it's serious, then why should we be taking action? I think the critical point is using social media to counteract the systematic misinformation of the Murdoch media in particular, and commercial reactionary elements more generally, because systematic change only happens when enough of the community know that it's bullshit for it to be called out regularly, and for those who are still in denial to be laughed at publicly. I think the one thing that government can't take is being laughed at, and I think we really need to put much more effort into spreading the message through social media and informal channels, because the one thing that all the psychology research tells us is that people put much more weight on information from people they know and trust than from the mass media. So the most effective way to change is through individuals.
Thanks, Ian. I'm going to call on maybe over here next to Amanda. Sorry for not being on. And I might bring Melissa Sweet into this discussion if you can throw yourself out of your notes for a moment to make some comments about media. And back over here. Okay, so
Ingrid Johnston from the Public
Ingrid,
Health Association.
sorry, Ingrid. Nice to see you.
So just going back to the determinants thing, we are definitely broadening it. We've had social and ecological in our terminology for a while, and it's starting to broaden out so that we're including cultural determinants, economic determinants, political determinants, commercial determinants, and so it's becoming a very long list, but they're all very much integrated. And I'm starting to think about how you get some kind of umbrella term like modifiable to make it clear that they all work together, but also to make it crystal clear that these are things that we can make changes on. They're not just things that are there and it's bad luck. And just to build on what was just said, with the Commonwealth Government being as it is, we can also probably do more to champion the state governments who are out there just ignoring the Commonwealth and doing it anyway.
And before you relinquish the microphone, Ingrid, just on the social determinants of health and the Sustainable Development Goals, do you want to just comment on the role of the Sustainable Development Goals in realising that vision around social and ecological determinants of health?
Yeah, I think it's really interesting because a lot of people think of the Sustainable Development Goals as just being about international developing countries and not really bringing it home to how many issues we have in Australia. And we're just starting to get the first reports out that show just how far behind we are on so many of those goals. And I think that people are understanding how linked the goals are, that you don't achieve them in isolation, but it's how we translate that into the political buckets of money. So they might see the links, but they still have their isolated silos of money, and somehow you have to be able to get across them. So there's a lot of potential.
Okay, thank you. And over here, Kate Noble from the City of Melbourne.
Hello, thanks for
It's been wonderful to hear the conversation. I don't have a health or public health background. I'm working on climate change for the City of Melbourne. But I think that health is such a core value in how we're trying to communicate to our community about the need to change. And I'm so impressed by the conversation that's gone on here. Fiona's done a brilliant research report for us on the relationship between climate change and health. And what I wanted to mention, which was really just to speak to the value of your work, and that is the authority that people from the health professions have in our community. I really could not state enough how important that is. So on top of all of the work that you're doing, please remember that because of who you are and your training and your standing in the community, you can make real change just by the work that you're doing. And so my thought is, as we're looking at how we can engage the community more around public health and the ecological determinants of health, is how do we support health professionals as spokespeople, and how do we work together? There's a lot of cities around the world who are connecting with each other to try to raise the profile in the face of Australian government inaction. Perhaps as well as the collaboration between all of the different health sectors, there's also benefit from unlikely coalitions or different voices coming together. And you can see that with farmers and property developers and medical professionals. So every city has a municipal health and wellbeing plan. There are dots that we can join better within local governments, but there's a lot of willingness to try to join those dots and a lot of resources in local councils to do that. So perhaps at the local level there's a way that we could collaborate more. And thinking about the media strategies that other groups have, like the coal lobby and those opposing climate change, we need to be just as organised on the progressive side and being able to tell stories about people's health in a way that's relatable to that core value. We can include case studies about your work. And my ad now, if you've got this, I will personally take action by. Our climate change mitigation strategy is open for public consultation until the 7th of October. If you Google Participate Melbourne, you'll find where you can put in your comments, and I think we could strengthen the relationship between the public health and ecological determinants of health examples with our climate change strategy. So please jump on that website and have your say, and it will help to feed it into our strategy.
Great, thank you, Kate, and thank you for coming. Good to have local government here, and good to see a local government taking on, that advice from health and looking at ways to embed health in your net zero emissions strategy, and offering the opportunity for collaboration. We've heard a little bit about media and the challenges associated with them, the reactionary rump in the coalition and the Murdoch media. Melissa Sweet, you work in this space. You're very passionate about communicating climate change and health. What do you observe about the challenges of communicating about this issue and how it's covered in the mainstream media?
Thanks very much, Fiona. Just quickly, people may not know, croaky.org, we're a public health journalism initiative. We focus on the underserved areas in health, of which obviously social determinants of health and climate change are a big part of it. We run on a very low budget, so we do the best we can, which I think really is an indication of where the media landscape is at. People who don't work in the media industry may not realise how decimated the business model for journalism has been. In the last decade, 15 years, several thousand journalists losing their jobs, which has a real impact on the quality of public debate and therefore public policy. So I would urge, when you're talking about social determinants, that you include public interest journalism as part of your model of social determinants and do that as part of your work in public health. It's too important to leave public interest journalism to the corporate media entities. I mean, Ian just mentioned Murdoch, which is obviously the other side of public interest journalism being a positive determinant of health. We've seen corporate media as a huge negative influence on health policy and health in so many ways. So the media landscape is fragmenting. There's peril and opportunity in that. We can now do things much differently and more engaging with community, telling stories in different ways, etc. But at the same time, we haven't really got public interest journalism platforms to challenge, the narrative from the corporates. The ABC is under such attack, and that whole idea of false balance has really held back a lot of coverage. So, in terms of advice, I think it all comes down to story. I tweet a lot on climate and health, and I shared an article yesterday, which I think Climate and Health Alliance tweeted out. We need another story to replace the stories that we tell now. And so, at Croaky, we would really like to do a lot more in this space. And I hope you don't mind if I just do a little plug here that one of the reasons I've come, apart from wanting to live tweet and help amplify your discussions, is that we really are looking for funding so that we can start covering climate and health in a much more systematic way. And help me create news stories about what health services are doing, to tackle climate change, to really look much more systematically at some of the things that need to happen to investigate, at all different levels.
Okay, that's really awesome. There's a couple of other people I want to call on, but I also want to throw to our other lightning talk. So if you are in the queue, can you just raise your hand now so that I can make a note? Stephanie up the back is the only one that I can see, and Janie. Okay, so we'll come back to you and Lisa, and we'll now hear from Joe Walker, Sue Cook and Kath O'Shea, and that will take our conversation out of the city and into the country. It will take us up to Queensland, and it will take us directly into a healthcare service. Joe, thank you.
Okay, we've got our National Rural Health Alliance hat on. I just want to, I'm not going to talk about climate change as the whole impact on rural communities, but I'm just going to talk about one aspect of it which is very topical at the moment, which is the concept of drought. So as you know, in health promotion, health promotion, we look at what are the causes from the social determinants and ecological determinants perspective, and what you see in the community is like an iceberg. I'm sorry to use that in a climate change context, but it's difficult not to. So at the top of the iceberg we see diseases and lifestyle risk factors, and the impacts of what's happening below the iceberg. And this is what happens with droughts. So drought is very slow. There's a hard pinpoint start and finish end. The impacts of it last long beyond the actual drought itself, and also that there's quite a lot of other things that go into the causing of drought. That is not just about rainfall or lack of rainfall or irrigation or water scarcity. It's about the bigger picture, about the economic globalisation market, the squeezing of towns, the changing demographics that are happening in rural communities, more older people, less younger people, poorer people, poor access to health services. So this is all going on out there right now. I just got a map here to just show you quickly from the Bureau of Meteorology. So this is from August, and you probably can't see it there, but it was announced in the media that pretty much 100% of New South Wales is declared a drought. There's patches of other places around Australia. So it's not just all in New South Wales. And the question has been raised, is this different to the Millennium Drought? Well, the pattern, no, it's not. At the moment, we haven't hit the 50% mark for a whole of agriculture. We're going that way. But what is different is that we're getting another El Nino pattern, which was responsible for most of the last Millennium Drought, 2/3 responsible for the rainfall changes. So we're not ready for this. Already we're not making those adaptation plans. So we're thinking, like, why didn't we learn from the last millennium drought? I mean, droughts are not unusual in Australia, but the frequency and severity and impact of them are now becoming much more profound. And what's happening is that the older farmers in the farming communities, their resilience is being tested to the limit every single time that these impacts happen. They're older, they're more vulnerable, and so, you know, the skill bases that we've got left in the communities, they're getting burnt out with the amount of involvement that they have in their communities. So how do we help them make these adaptations? And, you know, how do we actually change to sustainable agricultural models, for example? I just want to leave you with one quote from a farmer that I spoke to, as a dairy farmer down the south coast of New South Wales, and he just said, look, Joe, it's hard to be green when you're in the red. So that has always stuck with me, because he is a very young farmer, he wants to make changes, and he literally can't, because he's in crisis mode. He's selling off stock, killing off stock actually. So it's, you know, quite tragic when it's in the face. So these people are living it, breathing it day by day. Some of the health impacts from the last millennium drought that we know about, which were very quite frightening. There's a 40% increase in suicide rates, mostly male. But what also is missing and not really talked about a lot is the post-traumatic stress for children. So I would like to actually get some promotion about how we actually protect and safeguard the children in rural and remote communities. Okay, that's me.
So that's a perfect segue. If you could pass the microphone to Sue Cook, who has been working with CAHA on the development of the Human Health and Wellbeing Climate Adaptation Plan for Queensland, which we had the opportunity to share on both sides of the globe on 2 consecutive days last year. The Health Minister launching the plan in Queensland last Tuesday, and the Queensland Environment Minister talking about it at the Global Climate and Health Forum in San Francisco on Wednesday. Thank you, Sue.
Well, just briefly, a bit of background. The development of the health cap was part of Queensland's climate adaptation strategy under the Labor Anastasia Palaszczuk government, and CAHA and the National Climate Change Adaptation Research Facility were invited to work together with the health and wellbeing sector to develop a high-level plan and to come up with the priority adaptation directions key, and to facilitate ongoing sector-led collaborative climate change adaptation. So what we heard from our consultation across the state, it was quite a quick process, but 2 or 3 months. We heard that people are already dealing with the health impacts of climate change, particularly in relation to extreme weather events, drought, heat waves, floods, cyclones. And definitely the mental health aspects were as important to people who are in the services as the physical health aspects, and those post-traumatic stress factors were foremost in people's minds. What they also told us was that they lack any leadership, and they referenced the national government leadership, lack of leadership. There's no policy, there's no guidelines, there's no one telling them what's best practice, there's no one telling them, as people have said, people don't know what the facts are and what they're up against, although they're dealing with it. There's no proactive planning. But there was a strong appetite to build climate resilience in the sector and in the community. And the plan came up with 10 priority adaptation measures, and I won't go through them all, but they address most of those issues that we heard from the community, and also from scanning the best practice climate and health adaptation from around the world. But they include building risk management and legal liability assessment into everyday practice, and building those things into key performance indicators for executives and things like that. Developing sector preparedness and capacity, increasing the capacity, including specific public health interventions, building that capacity. and also new economic and financing approaches that take a wider look at all the relevant costs and benefits of climate change and climate change adaptation, and being able to build that into your business case. So also support for local planning of climate change adaptation, involving the community, and that local level there was a strong desire to see that within a consistent state and national policy framework. So the next steps in the process, we'll wait and see, but it has just started, that process. In Queensland, there has been no authorising environment to have those conversations. This was the first time people had been given permission to talk about this, and they flocked to it. They really jumped to the opportunity. The Department of Environment and Science is now developing an industry-government co-funding mechanism to help support some projects to get off the ground. And this week at the whole of government and community level, Griffith University and the government held a government risk management symposium addressed by former PM John Hewson and Sarah Barker from Minter Ellison, and really looking at those financial and legal and institutional risks of climate change and government responsibilities. And so I think we're at the start of a significant first step in the right direction in Queensland, hopefully.
Wow, that's great. Thank you so much, Sue. It's very interesting that kind of issue of legal liability that the Queensland Health and others have really kind of leapt into that conversation, so it's an important one to have. Very interesting that we had incredible buy-in from the sector and a huge amount of feedback, and yeah, a lot of support from the sector, which wasn't reflected or recognised in the rather hysterical response that we had from Senator Matty Canavan, who took great exception to the fact that the injecting drug users were identified in our consultation as a vulnerable group. And the suggestion that the entire plan had been dreamt up at a poetry slam in a hippie cafe, not reflected in the extensive media coverage we had in other media outlets. Kath O'Shea, can I call on you to talk about the great work that Western Health is doing, one of our proud members of Global Green and Healthy Hospitals in the Pacific region.
Thank you, Fiona, and thank you everyone. What a fascinating discussion. I've been very lucky as a sustainability officer at Western Health. Western Health provides public health to the western suburbs of Melbourne. I think we've got 7,000 staff and about 800 throughput per annum. And so I've been there 7 years now, but my position was forged by a green champion that you probably all know, Forbes McGain. He kind of got me my job at Western Health by pressuring the CEO to his Doctors for the Environment, and just a fantastic, fabulous green champion. So Western Health known really profiling environmental research in health, and that's really thanks to Forbes and his leadership. And so alongside Forbes, really, it's been about operational sustainability, and so we've had three kind of environmental management strategies. The first one was 2 years, and it was really about governance and creating a sustainability committee with high-level decision makers who could really say yes when they felt an idea was good and when it was explained well, and when they joined those dots that we're all talking about. And that's been a fabulous forum because it has led to a more mature discussion over the years. And people, you know, I think the executive does get it. They want to get it more. They find it hard to incorporate, and they're always very welcoming of ideas. The second kind of 2-year environmental management plan was about resource efficiency and business cases that, you know, I don't think I've ever had a business case knocked back. You know, they want to see them, and they are happy to act on them. So that's great. And the third one now, I was able to then hook into the strategic cycle, which was a 5-year, 2015 to 2020. And that was about embedding sustainability. So I guess also in that middle, the second environmental management phase was we partnered with CAHA, or really took on those global green and healthy hospitals 10 goals for operational sustainability, and what do they mean. And that led to some really great thought bubbles, and it was a great resource and support to a healthcare service trying to grapple with these things. We partner annually with CAHA and International, the Institute of Hospital Engineers Australia. Yeah, to put on a healthcare environmental sustainability forum, which is it's as much for ourselves as for anyone else, but it's just pushing those dialogues that we're finding stuck on and trying to get more buy-in. To have those discussions and have some presentations about people really thinking in that space, and that's great fun and very. This year we had. I was so lucky to have David Pension from the UK speak at our forum as a keynote, and I guess midway through this 5-year strategic plan, it just really kind of brought home what we need to do, that it's, lift your eyes up and look at connection and collaboration and really, models of care, the determinants of health, and really trying to, get the conversation to be much more complex and much more diverse and much more connected, I guess, is the thing that I see. But I guess something about that 5-year strategy and embedding was the commitment to developing 50, 10-a-year local sustainability action plans in kind of pharmacy and radiology and wards and finance and sustainable procurement and all these kind of local action plans, and trying to have a different conversation with the different staff group about what healthcare environmental sustainability means. And that's brought out some really wonderful champions from different areas. It's real bolt out of the blue was Grace Wong, who was thinking about this in her kind of private life and forming a little peak body called Pharmacists for the Environment Australia. And she kind of joined the organisation and found me, and we're like, wow, awesome. And so she's become a bit like Forbes, just really driven and prepared to speak eloquently about sustainability in healthcare and with a pharmaceutical kind of bend. We're all great support to each other because you need support in this kind of thing. You do have bad days. But yeah, I think it's a promising environment at Western Health, and I'm really happy and grateful to be there. But it kind of goes to trying to kind of vouch for what all you people are trying to do, particularly through education, bringing us clinicians who are open. There's a dialogue there that they can join it. That they know how to join it and what they want to say when they join it. Research, there's a lot of Forbes' research is around single-use items compared to reusable items, and infection prevention research and infection prevention. It's really important to ground, we're starting to push back and kind of say, single-use tourniquets or something like that. Why? We want to see the research, and it really helps for us to have research on the other side too, to say, where is the line between risk of disease transmission and recycling or waste minimisation. That's a really hard area in health, and infection prevention is very strong in the health paradigm, of course, rightly, but this needs to be practical and appropriate. So yeah, that's probably most of what I wanted to say. But yeah, education, and thank you very much.
Thank you very much, Kath. We've got a few other stars from our Global Green and Healthy Hospitals network in the room too. So I think just to keep that conversation around at the coalface on healthcare just for a moment, I'd like to call on some of those people to make some comment about what's happening in your institutions, but just to provide some context for people who are not aware of Global Green and Healthy Hospitals and the work that CAHA leads in Australia around that. I wonder if I could call on my colleague Libby, who coordinates that program in Australia and New Zealand, to just provide a bit of an insight into what Global Green and Healthy Hospitals is and what's happening.
So CAHA, in sort of partnership with Healthcare Without Harm, coordinates the Pacific region for Global Green and Healthy Hospitals, which is Australia and New Zealand. Global Green and Healthy Hospitals is an initiative from Healthcare Without Harm to really facilitate health services to deliver healthcare in an ecologically safe way, to remove, we all know that healthcare is high waste, high energy use, lots of chemicals and so forth. So it's to reduce that harm and to give people the tools, or health professionals in hospitals and aged care, right across GPs, everywhere really, the tools and the connections with which they can progress whatever they're wanting to do and doing. And it goes again to what we were talking about in relation to the nurses. There's lots of people doing lots of fantastic stuff, and this is a really wonderful tool that connects people and enables them to actually progress what they're wanting to do or to start. So people can become members of Global Green and Healthy Hospitals, or health services, not people, but health services and organisations and so forth. The ANMF is a member, the student doctors are, lots of organisations are, as well as hospitals. It is massive now. There's over 32,000 health services and facilities worldwide. In Australia, we're over 900 now, nearly in every state and territory. In Victoria, we've got lots of people here, obviously. The Department of Health in Victoria is a member, Western, Melbourne, Austin, loads of places, right down to Kuirup and along the coast. So it's fantastic. In Australia, as I said, there's 900 or 44 actual members representing 900 hospitals and health services. And that's Australia and New Zealand. New Zealand's got health boards, so that means that a whole service is a member, which is fantastic as well. And what we do is one, sort of let people know about it. So I want to, anyone who works in a facility and is interested in having a conversation, come and talk to me about it during the day. But we also support people who are members to get things up off the ground, and there's a climate health challenge that is a really great way for people to focus energy and activity around mitigating, around resilience, around reducing carbon emissions.
That's awesome. Thank you very much, Libby. And we've got some people who are stars in the network here. I wonder, Lisa from Mercy Health, could you tell us a little bit about what you're doing? And we will need to keep our comments really short because we're drawing to the end of this session before we kind of break out into a bigger conversation about what we do next. So let's try and hear from as many voices as we can.
Sure. So I'm Lisa Rasmussen from Mercy Health, and Mercy Health's about 9,000 employees, and it's got 2 big hospitals here in Melbourne and a bunch of aged care over a number of states and a number of other facilities. But I just wanted to make 3 comments. One's a big, middle and small comment about change. And I think we were fortunate on the back of Pope Francis. And when we were talking about language, I think there's something in his language that might be a way to go to help us around how to communicate messages. So we got to aim quite high because of his encyclical letter from a few years ago to the whole world, particularly more the Catholics and all of this. But which was about Laudate Si, which is care for our people and the planet, or care for our common home and its people. So there's something in an idea like that so much can come under, like everything from the narrow meanness of our migration debates, and if we're going to have hundreds of millions of people, but literally trying to find a place to be, ideas like that for us to really hold on to, about just caring for our people and this planet, and the ideas around non-partisan approaches to our economic systems, you know, is it caring for our people and its planet might be quite helpful. It certainly helped us get quite a large agenda for change up at the Mercy. And I was only employed a day a week, but I said, if you want to have a big agenda, put me with someone on executive who's just sitting over there, Julia Trimboli, but we work together. It just means with a large agenda, we've got a platform to be talking to the board all the time. So that's made a big difference. I just wanted to say one thing that has happened at our level is we very quickly really have got into the strategic plan about the importance of caring for the planet and its people in terms of everything the health service does, and already we're starting to think about sustainable models of care, and already both gynecology and aged care are starting to talk about the way they're going to frame everything is based on the strategic plan and thinking about what that would look like. And immediately that makes us think about our way we fund everything and thinking, well, who should we get together to think how we fund hospitals and change it. What else? I'll stop. I'll just hit a couple of. I'll just jump to the small bit. So it's meant we've been able to employ an environmental officer, and we weren't able to because the organisation said it had no money, but we have. We've also employed one of the Mercy sisters who's a skilled listener, with the idea that, you know those ideas that you can only change the world one by one, and if we really want to tackle the fear that everyone has, the powerlessness that everyone has, if we want to give people a hand around their privilege, around racism, to be kind and gentle and listen and listen and listen. So she'll be working, at that level to help each department or ward be part of our bigger agenda, and but also to have some autonomy for change in all their smaller areas. So anyway, that's a little bit, but there's a lot that framework's given us a chance to actually make real change, I think. Thanks.
Thank you, Lisa. I'd now like to call on Nari Gabor from Mater Health in Queensland, who are also doing some great work. Nari, can you put your hand up so Eliza can hear you? There you are. And just that point on listening, Lisa, I think is a really interesting one. You'll recall that David Pension, brought that issue up a lot when he was in Australia talking about the work of the Sustainable Development Unit, and when it was formed, and thinking that they knew the agenda and how to go about it, but really were persuaded to engage in a lot of listening, and the way that they set about their work was completely changed as a result of that. So, and it's great, there's lots of listening going on here today, so hopefully that's useful for everybody. Nari.
I just wanted to say I'm from the Mater Hospital, so we are also benefiting from the Pope's encyclical, and we've just had that recognised in our strategic plan just a few weeks ago. For the first time, the word climate change is in there. Yes. But yeah, I just quickly wanted to say one invaluable thing for our work at the Mater in Sustainability has been CAHA and its network, and I've personally and professionally benefited from people who are willing to share, and it's very generous. I've had, all sorts of templates, and, I've nagged and borrowed and stolen. Tiernan has sent me great info, and Kath, so I just wanted to thank all of you at CAHA for helping us progress. It's a slow, challenging process, and we couldn't do it if it wasn't for this group. So, but we've had a bit of a history over 8 years at the Mater, and we've really taken stock this year and done a big review. We're hoping to take some of that information and advice from David Pension to go out and survey and speak to our stakeholders who are really getting loud since the war on waste, I have to say. And there's a bit of a wave of, what do you mean I can't have 5 more bins over here? So, we have to try to ramp up to meet that demand. It's great. That's all.
Thank you very much. Now, I've got Stephanie on my list, and we might circle the conversation back around to communications. That's interesting, the point that you make, Nari, about the war on waste, and as a communications tool in terms of engagement, what that offers to the rest of us, and how can we capitalise on that?
Hi everyone, I'm Stephanie Hall from the Monash Climate Change Communication Research Hub, and We conduct social research into the most effective ways to communicate climate change, and what our research has showed us is that information has to be repeated often to large audiences, but most importantly it has to come from trusted voices, and they have to be localised. Because 2 degrees doesn't mean anything to a lot of people. People are busy, it just doesn't really resonate. So sort of bringing together a lot of what we've spoken about today, we've actually been able to secure a column in News Corp of all papers, a weekly climate column. Will be launching in 2019 in leader local newspapers in the 26 mastheads around Melbourne. So we're developing that at the moment, and we really see this as an exciting vehicle to bring in community voices, especially from health professionals who, in our research, and a lot of research I know from SV as well, are incredibly trusted. So I just wanted to put it out there that we're looking to talk to anyone who wants to talk about how climate change is affecting their local area. We've got that vehicle now, we're bringing all these parts together, so I'd love to have a chat to many of you, sustainability officers, doctors and nurses, about bringing that information to people in their areas, because that's what people need.
Thanks. Before you hand over the mic, Steph, I wonder if you might also share about the awesome program that you have around weathercasters.
Yes, so the newspaper program is actually a second iteration of a current program that we're doing with, again, about bringing climate change to mass audiences, using television weather presenters as climate communicators. So we've currently got this being broadcast on the ABC and Channel 7. So, the commercial element is really important. So that's, again, making the distinction between climate and weather and showing people long-term trends, what has happened, we've got 50-year climate trends currently being broadcast to, millions of Melburnians, and then we're actually going to be working with the CSIRO to show projections outwards, using 2 forks in the road, using if we meet our Paris Agreement, or business as usual. So really showing this is where we've changed from 1970s to now, but this is where we could go. So it's really exciting, again, making climate information really visible in a way that it hasn't been.
Thank you very much, Steph. I'm going to call on Jane. You your hand up a little while ago, and just while the microphone is being transported, just to say how great it is to hear that kind of mantra, simple messages repeated often by trusted voices, which is something that our mutual friend Ed Maybach from George Mason University in the US, who's really led a lot of the work around the research on the link on how to communicate about climate change as a health issue. And I was lucky enough to see Ed last week and attend one of his workshops at the Global Climate Action Summit, and he started with simple messages repeated often by trusted voices, and really emphasising that health voices are incredibly trusted voices, and also to point to the resource that exists in the form of the Climate Media Centre, which is an initiative of the Climate Council, which supports for purpose and organisations working in this space to help amplify their voice and to get some media coverage. And they were really helpful when we were releasing the Health and Wellbeing Plan for Queensland last week. 9 pieces of media coverage, ABC TV, ABC radio syndicated across the country, ABC online, several other newspapers, quite extensive coverage to the point that it attracted the ire of the Senator Callaghan. But also just to let people know that the Climate Media Centre is always looking for health voices that they can use to help bring that perspective to this debate. So either through me or through CAHA or going directly to Climate Media Centre. If you want to be one of those voices, I really encourage you to get in touch with them. Janie.
Just perhaps a framing thought for the next session of what will it take to get action on climate change. It's interesting to reflect on how much we're focusing on adaptation or mitigation, and from the conversation so far it seems that there's a bit of both, and adaptation being sort of building social and environmental resilience, whether it's through working with rural communities or with individuals and patients and organisations, and then from a mitigation perspective, preventing environmental impact, whether that's through carbon emissions or waste reduction. So I'd be interested to hear what people think the relative priority should be at this time on with regard to adaptation and mitigation, and whether, perhaps they're not easily ranked. And I think it'd be interesting to reflect how often we actually connect our strategies, like say policy change or trying to get a position statement within an organisation, with that ultimate outcome. Are we really trying to focus on mitigation or adaptation, and making sure we're communicating that with the organisations that we're working with?
Okay, I wanted to circle back around to research briefly, but to go to that point, Jamie, there are, just to say, there is some guidance from CAHA in terms of, and the health sector really, about what the priorities are on adaptation and mitigation when it comes to climate, health and wellbeing in the form of our framework, and those are spelled out there. In terms of adaptation, I think the Queensland plan offers some useful insights into what the health sector have told us that they want to see in an adaptation plan, but it would be good to unpack that a little bit more and hear from other people. And if we have time to hear from policymakers in the room about how they are going about embedding those things into policy, I'm going to call on Venora Malvena, but first I wanted to call on Rebecca Patrick. Are you in the room at the moment, Rebecca? I am. Well, just to kind of circle back around and on research and the research agenda that Ying introduced us to at the beginning of the day, and just a comment perhaps on the need for a nationally coordinated research agenda around climate change and health.
Absolutely. So in a recent submission coordinated by Fiona to the MRFF, we reached out to researchers, many of you among us today and others, to identify what the climate and health priorities were for Australia. And so in that submission we started to do that piece of work, building off the back of NCAF's work as well. But what we did identify that there is no clear set of priorities for Australia, and there may be an opportunity going forward for us to develop a coordinated approach to identifying those climate and health priorities. So we're about to set up upon a piece of work to get together across institutions and look at what priorities are, the infrastructure needs are for progressing research in Australia.
Thank you.
Is that what you need?
Perfect, thank you. And so now I'm going to call on Annabelle Workman, who's been involved in some similar conversations in Victoria around, what is the climate and health research agenda? How might we have a coordinated conversation about that? And just to follow on from Rebecca's comment, one of the things that CAHA is going to do in coming weeks and months is to coordinate a conversation among people who are doing research in this space, to tease that out a little bit, to see what role we can play in terms of coordinating climate and health research nationally, and really just put people in touch with one another so that they can get an understanding of who's who in the zoo, who's doing what, where are the skills, where are the gaps. But you're doing interesting research, Annabelle, that straddles the divide between research and policy. So I wondered if you just might comment on the research agenda, but also tell us about the research that you are doing and how it relates to policy in this space.
Thanks for that, Fiona. I'm not sure, I think you've already probably very comprehensively covered just then in your generous introduction about that. I'm a PhD coming to the end of my thesis at the moment. My project has been looking at the role of healthcare benefits in the development of national mitigation policies, and I've been lucky enough to interview Australian policymakers, European Commission policymakers. We've also looked I've analysed a few climate policy documents for both China and the US to get a sense of whether or not healthcare benefits actually have a role to play in mitigation policy development at the national level. But coming back to Fiona's initial point, which was around climate change and health research agenda for Australia, I think that as a result of my own PhD and
the work that I've been undertaking here, it's become clearer to me that at the moment, and maybe there are networks that exist that I'm just not well connected to yet, but there did seem to me to be a level of a bit of a disjointed approach to climate change and health research in Australia, and an opportunity really to try and make a more cohesive climate change and health research agenda for Australia. And it sounds like there's incredible work happening in Sydney, the MJA is undertaking, but certainly I think there is an opportunity for us to put together a more strategic research agenda, similar to what was done in the US in 2010, where there were actually interagency group that came together with the support of the research community and actually really crystallised what the climate change and health research agenda should be, where the data gaps were, what was required really to help policymakers to integrate health into the climate change agenda or climate change mitigation and adaptation policies. So with that in mind, I think there's some proposal at the moment at the Melbourne University that's hoping to undertake a review of Australian literature on climate change and health in order to try and identify where the gaps are and what the research, where research is being undertaken, so that we can be more coherent and cohesive in our approach to really try and be strategic there. Coming to your second point, in terms of kind of straddling where research is and how that science policy interface, how we can actually enhance or improve the uptake, the political traction of health in the policy agenda. I guess I can only speak from the national perspective because that's been my focus, and I appreciate that there's some incredible work happening at the state level and even at the local level with Melbourne, Victorian government, Queensland government. But certainly I think at the national level there needs to be, we need to be clear about what the barriers are there and the realities that we're working with. So one of the major findings from my work has been that a key barrier is around the discourse. And unfortunately when it comes to climate change and action, a lot of the time governments focus on costs, particularly those upfront costs. When you consider health, a lot of the time those benefits are diffuse or indirect. So I think we need to be better at framing the benefits and the opportunities from action and incorporating in as quantified and monetized way if we possibly can, acknowledging that there are limitations to that. But there are benefits and opportunities from action. And also acknowledging the institutional realities that we face, and the fact that in the National Health Department, the climate change and health team is about a handful of people. And so, when those are the resources you're working with, that's a barrier at this point in terms of incorporating or enhancing the role of health and climate change agenda at the national level. Is that okay?
Lovely, thank you, Annabelle. And just to speak to a real live policymaker, we were going to hear from Daniel Voronoff this morning, who was going to talk about the work that Victoria is doing to develop a climate and health adaptation plan, but he's got 2 sick kids, so he's not here. But Venora Malvena is here, and she works in DHHS on climate policy, and was one of the authors of the framework for a national strategy on climate health and wellbeing. And I'd also like to say that sitting next to her is Nick Horsburgh, who is also one of the authors. So really great to have you both here. And I wonder, Venora, I'm putting you on the spot, and I know you're not actually working on that piece of work, but I wondered if you could talk a little bit about how DHHS is working to bring climate change and the health impacts of climate change into policy and what it's doing.
Thank you. So I think I know people have mentioned perhaps some inaction at a federal level, but I think I'm really pleased to see, certainly at a state level in Victoria last year, that we now have a Climate Change Act in Victoria. A whole lot of work that's being led by the Department of Environment, Land, Water and Planning, which we're a big part of. I know we have at least one rep here from DELP today. From the department's perspective, I think having a legislative lever is really important. That Act requires the development of adaptation action plans across a number of portfolio areas, including health and mitigation plans as well. So those requirements come in a couple of years' time, but the Department of Health and Human Services is one of 3 portfolio areas that are actually developing pilot adaptation action plans. Pilot plans are also being developed by the water and agriculture sectors, and I know Delph's been doing a lot of work to coordinate between the plans. So from my perspective, where I sit is in the health protection branch within the department. We have a real focus on managing things like drinking water, food safety, infectious diseases, vector-borne illness. So from my perspective, a lot of focus at the moment in our branch is contributing to that pilot adaptation action plan. What can we do in terms of adaptation? How can we better quantify impacts? We hear a lot about heat health impacts. Do we hear a lot about other incidents like the Ross River virus outbreak that we had last year? It was a big one. How can we better quantify the impacts and bring in a better range of data to communicate what the impacts are? I agree with what others have said around the importance of focusing on the health co-benefits of climate change action. That's certainly something we're really looking at. What opportunities do we have to improve health? A lot of people have mentioned David Penchon in his talk today. I think he had a great quote. What if climate change turns out to be a hoax and we create a better world for nothing? I think it doesn't matter, this debate around is it real, not real. There's a lot of things we can do that are really going to be beneficial to health, and how can we focus on that? So is that enough, Fiona?
Thank you, that's wonderful. Tiernan Humphries, you're here, and it would be good to hear about the work that you are also doing in DHFS around sustainability and health services. Could you just comment really quickly on some of the kind of standout work that you think is happening in that space?
Okay, thanks. Tiernan Humphries, Department of Health Human Services. I head up the sustainability team in the department, looking after sustainability across our 86 health services, around 1 million tonnes of carbon per annum from stationary energy. 2 key things we're doing at the moment with this protocol actually. One is, Frank earlier talked about the solar panels that have been put on Korea Hospital. That's part of a larger program. We're installing over 2 megawatts of solar across our Queensland hospitals. We're also installing 2.3 megawatts across our Barwon and South West hospitals. So there's huge amounts of solar being installed. The largest solar array hospital in Australia will be in Sale with 750 kilowatts of solar. We're also doing a lot of work around waste education with Sustainability Victoria and the AMF. We've got a waste education officer. We've got a work plan for the next 2 years where we're focusing on a number of interventions, including single-use medical items, PVC recycling. We also work with the EPA to update the clinical waste guidelines, which is a very key document in how clinicians determine what clinical waste is and where it can and cannot be disposed of. When you think about the clinical waste only accounts for 10% of our waste mass, but accounts for 66% of our waste cost. It's a particularly big cost to the health system. We are about to kick off a bit of work too, looking at how we can improve the vehicle fleet efficiency of health services. So we spend over 20 million a year on cars and driving them around to deliver services. Not saying that's not important, but it's about what types of cars we have, how we maintain them, how we drive them. There are probably a number of things, a whole lot more happening. Hopefully there'll be some big announcements around our environment strategy in due course.
Awesome, thank you very much, Tiernan. Now we've reached the point in our meeting where we're going to talk about what's next, but I've got 3 people who are on my list, young people that I would like to circle around before we close that off, because I think there's some contributions that they can make. I just wanted to go back to the conversation on education gaps, and just to highlight that with the support of the Lord Mayor's Charitable Foundation, we've offered training for health professionals and will offer further training for climate health champions. We've had very positive feedback from that. There's a lot of appetite for it. You know, as we've heard, people need support to build their climate health literacy, to help them communicate to their peers, to their patients, to their managers and to decision makers. And to get a student perspective and someone who's participated in that training, I wondered if I could call on Danielle Shute. If you could just, without warning, share your insights as a student of Masters of Public Health in terms of climate change and health, but also what you found from the training that you did.
Yeah, so as a student of Masters of Public Health, I have to say that a lot of what's been said around the room definitely rings true. I study at the University of Melbourne, and actually climate change is heavily focused on. I would say it's constantly brought up within that framework of the social determinants. So it's good to hear that that's definitely permeating. In terms of the training, something that, like a key barrier, I guess, that really stood out for me when speaking to people about advocating on climate health was that most people brought up the fact that they didn't know enough about the science, they didn't know enough facts, and that was a key thing affecting people's confidence going forward. And it was definitely something that I felt as well. I felt, how can I sit there in front of an MP or any sort of policymaker and, you know, make a stance about these things if I don't remember the stats, or if I don't remember, you know, how many tons of CO2 it's going to take to do this, or, you know, and that was a key thing that was consistently brought up. So I think, yeah, it was really trying to tap into what that passion is, putting that fear aside, and really helping convince people that, yeah, we all do have a voice in this, and there are things that I think are important that, you know, are important regardless of whether or not I remember, you know, every single nitty-gritty detail about, you know, policy in the US or policy in Australia, things like that. So,
thanks, Danielle. I'm now going to call on Phoebe Roundtree, who is part of delivering that program, partly with that perspective, but really from the point of view of the organisation that you're now with, the Australian Conservation Foundation, and speaking on behalf of the environment movement, if you like, you can talk about what, how health is important in terms of communicating in that space, and why you are here, and why you see this cohort and this message as being important in the work that you do.
Thank you. Thanks, Fiona. And fantastic to hear everyone's reflections so far. It's been a fantastic morning. Just to sort of start by speaking to Danielle's point, I really want to highlight that I think there's a role for all of us as, you know, health professionals or researchers or being from the environment movement to encourage our networks to really trust their own story. So, being from the environment movement, a lot of what we're trying to do at the Australian Conservation Foundation is about activating everyday citizens and acknowledging that, as Danielle has said, they don't need to know every little gritty detail, but they have a right to approach their MP. We do a lot of work holding politicians to be accountable, and they have a right to approach their MP. They have a right to be heard, and they have a right to tell their story and to ask for our representatives to do better. So I think that's one really important thing to remember. Two sort of other reflections, and just let me know, Fiona, if this speaks to what you want me to speak to, is I've heard consistently this theme of collaboration come up today. And speaking from the environment movement, I know that our supporters love it when we collaborate with other organisations. Because one, they see that we're more powerful that way, but two, often our supporters, so supporters of ACF, for example, are also supporters of 350.org, they're also supporters of Greenpeace. And so when they see us collaborating, they see that they don't have to make a choice between being a supporter of this organisation or a supporter of that organisation. So I see a lot of overlaps in the sense that you probably have members that stretch across the different organisations here and supporters that stretch across the different organisations. So collaboration is really valuable in that sense, not making them choose. Just the last thing I wanted to quickly tap into was, I think we have a real role in providing solutions. Climate change and health, in one way, is a very complex issue and there's a lot of elements and a lot of contributing factors in there and a lot of different ways we could approach solving this problem. But at the same time, it's also quite simple. You know, we know what's causing climate change, we know that we need to reduce our emissions, and so we have a real role in communicating the fact that it is quite simple in a way, and here is how we can make change. And one thing that we found from a campaign's perspective in the environmental movement is that our supporters love it when we go, hey, here's the problem, but here's what we can do about it, and here's how you can get involved. So I see a real role for us in simplifying that problem and telling people the clear way they can get involved.
I might use that as an opportunity to take us into the next part of the session to say, how are we going to put the ideas that we've raised here today into action, and how can we collaborate going forward? So Phoebe's finished on a note around collaboration, which is fantastic, and we look forward to collaborating with ACF on our work going forward. And Catherine Middleton, who you heard from earlier from the Australian Medical Students Association, and I were at the Global Climate Action Summit last week, where there was announcement after announcement by collaborations and alliances, and it was a very popular theme. I mean, we certainly feel here as CAHA, or as an alliance, there's a lot of value in bringing people together and bringing those voices together to become a powerful voice together. So I'd be interested to hear what people think about how we can collaborate together in this room, whether that's with Climate and Health Alliance or as partners of Climate and Health Alliance, whether it's as members or as partners of Climate and Health Alliance. So I'd like you to all just take a couple of minutes to pick up that piece of paper that you had either on your seat or in front of you, which has got the topic of the symposium today: climate change is a health issue. What will it take to get action to respond? And we would, as I said in the beginning, love to hear from you about what are the actions that you might commit to taking. And I guess taking a leaf out of the Global Climate Action Summit in California last week, it was all about action. It was very different to the UNFCCC COP discussions where all nations come together. There's lots of very long text written, and you have a conversation, and then someone opposes it, and then you'll have to all decamp and go away and have a long conversation about what to do. The Global Climate Action Summit was organised by Mayor Jerry Brown, the Governor of California, to help spur action in between the signing of the Paris Agreement in 2015 and 2020, which is the reckoning, when our nationally determined commitments will be evaluated, and we will see how we're going on that pathway to 2 degrees. I guess, I did want to make the point that we are, meeting at a time where there is an incredible amount of momentum and action, and we certainly heard about that in California. You couldn't get on the podium in California unless you were announcing something. So whether you were from industry or government or a coalition of mayors or a coastal authority or a municipal group, you needed to be making a commitment to action. And there's something to be said for that. It's very exciting to be in a space where there's a lot of action and momentum. So that's great. There is a lot going on, but at the same time, with this is in a context where in a couple of weeks the UN will release a report on 1.5 degrees and on what it will take to limit global warming to 1.5 degrees. It will tell us that to stay below 1.5 degrees, itself not a safe level of warming, given the catastrophic impacts that we are witnessing at 1 degree, we need to peak emissions and go beyond zero. So we need to go to negative emissions. We need to remove carbon from the atmosphere. Once we stop putting it there, at the moment we're still putting it there. So this is a time where we do need to think about action. So if you're willing to make a pledge that we can use to showcase the commitments of people in this community, we would be pleased if you would do that. And also if you can comment on what you see as the answer to the question about what it will take to get real action, action that's commensurate with the scale of the task. We'd be pleased to capture that as well. So we could take a couple of minutes to do that, then we'll use the rest of the time until 11:30 to hear what some of those things are. Then we will break for morning tea. Danielle will be available in the photo booth at that moment. Hopefully someone will make her a cup of tea and coffee. And we will then, I'll share what's happening for following that. But while you're thinking and writing, I just wanted to throw back to you, Catherine Middleton, who was at the Global Climate Action Summit, about what some of the highlights, lessons, insights for you from that meeting.
Okay, I can speak into that. I think one of the major takeaways is definitely surrounding collaboration and stopping thinking about climate change in terms of silos. It's how, like even in the healthcare sector, we look at health within silos. And we're doing the same when it comes to climate. We're looking at it from agriculture, we're looking at it from health, we're looking at it in silos when we really do need to work together to get tangible action, but also it's the best way to sell action on climate change. Like if we eat a healthy diet, a more plant-based diet, there's a way to transition towards more plant-based diets that's going to end up benefiting agriculture, and it's going to end up mitigating climate change, and it will improve people's health. And I think if we consider action on climate change in more of a collaborative sense, that's how we sell action most effectively, in my opinion. And that's how we're going to get the most effective action, is like tackling a problem from so many different levels together. And I think that's what I took away the most from the Global Climate Action Summit. Also, I think I learned a lot about, when we were speaking about the lack of leadership from a Commonwealth level, there was no better example about how states can band together than what's happening in the US at the moment. Like all of the states, like the states that were represented at the Global Climate Action Summit, were committing to such powerful action to mitigate climate change with no national leadership whatsoever. And if we can follow their example, then I think there's still hope. There's still heaps of hope. I actually came away empowered by what I'd seen rather than hopeless. So yeah, there's my music.
It was very blockbuster.
It was very blockbuster.
So, who's got the answer? Ian Lowe has the answer. Wonderful.
I used to tell my students that the American H.L. Mencken said that every complex question always has a simple answer and it's always wrong. So I worry about there being a simple answer, but I've written increasing community awareness, making political inaction indefensible. I think that has to be our goal. Could I just make a comment on the issue of whether it's mitigation or adaptation? I think clearly it has to be both. I like the mantra, we have to manage what we can't avoid and try to avoid what we can't manage. We need to remind people that further change is inevitable because of the long time lags in the system, but whether the future is bad or catastrophic depends on the action we're taking now. So we have to be working on both fronts. I'll just give one concrete example, which I think is very good for communicating climate change. It's water availability. Because it's an example where different impacts of climate change are compounding. The deniers say we've always had drought, and we have, because we're the inhabited continent with the most variable rainfall and the driest inhabited continent. But climate change is not just changing rainfall patterns, but changing the conditions that apply on the ground when the rain happens. a concrete example is Perth, where, as the science was predicting 30 years ago, the average annual rainfall is now about 70% of what it was before 1975. But because it's hotter and drier when it rains, the average annual runoff to the water supply system is literally a third of what it was before 1975. And the situation in Perth would be catastrophic already if they didn't have desalination plants. They just would not have water. But there are parts of Australia where desalination plants aren't practical. There's no water to desalinate. So we need to be reminding people that parts of inland Australia will be uninhabitable unless we take serious action now.
Michelle.
Some quick ones just based on the small study that we did and also what I've heard today around education and the solutions, getting executive and CEOs on board. There's a lot happening in the business community with the disclosure on climate risks, and that's both looking at climate risks and also how you need to then plan for the transition. I think there's a lot of momentum there that we can learn, and what we learned from our study in speaking with the sustainability managers and leaders that need that executive support. And so we interviewed board members. They really want to receive better education. They want training on the job. Even if they've received it through their studies, they need it in the organisational context. And I think there is momentum around that at the moment, and so we should capture that. Secondly, just quickly on SDGs, big framework. Climate Works is hosted by the Monash Sustainable Development Institute. We recently just tracked progress on how Australia is going. You look at health individually, that actually, from our assessment, looked okay, which I really welcome you all to challenge. When you look at that with climate change, of course we're not going well at all, and so we need to have a better and stronger narrative around that. We've started that, need to work with you better. And just a local example, I have worked locally with Kate and others, and when I had my first baby, I was involved in a study pushing around a pram with 300 other parents, and what we measured, had on our pram, is measuring vehicle emissions. And so at that pram level, rather than where they measured it, building level. And so with 300 participants in that study, we were able to have a heat map of where those impacts were. That was they were able to, the researchers, to use that to inform policy change. If we can have those local stories, those local research scaled up, so we need an evidence base, but we also need the connection. And our Generation Next work showed that young mums, I would say I'm a young mum, but young mums are actually, key to unlocking mainstream conversations and acknowledgement around climate change, but also the impacts that affect their health and well-being.
In the spirit of making a commitment, we talk a lot about intersectoral collaboration, very important. I think there's also a significant need for intra-sector coordination. We spoke to that around the Climate and Health Research Agenda. Research institutions as a sector. I think I'm fair in saying we're guilty of silos, we're guilty of territorial approaches, I think, and there's an opportunity for some intra-sector coordination around developing a research and climate and health agenda. Great to hear about your work, Annabelle. I'm sure there's plenty of other great research initiatives along those lines emerging. We haven't spoke. There's a need to reflect and connect, and my commitment at CAHA is to create a pathway around that. Thank you.
Annabelle, and then Peter.
I appreciate that this might be a bit of a controversial thing to say and perhaps addressing the elephant in the room, and I wish I had a solution, but I don't yet. But I think it's important to acknowledge that we need to get creative about how we incentivise the losers of climate action, particularly acknowledging that at the national level that vested interests
sometimes undue influence on the development of policy. And we need to think about how we bring them along or make them part of thinking about the solution. One thing that I think is work that's going on certainly in the healthcare benefits area is to look at what the implications are on labour productivity. Because if you can communicate to businesses that their bottom line will be impacted because of the health implications on the workers, that there's an economic incentive for action, I think that's something that we need to explore further. And fortunately, I don't like it, but I think it has to be part of our consideration and part of the conversation.
Well, I'm going to introduce an element that we haven't really talked about, and it's simply that we're all going to have an opportunity in a few months' time to make a difference. And frankly, if you don't vote Labour or you don't vote Green with a second preference Labour, then nothing's going to happen for at least another 3 years. Either we change the government in the next 6 months, or you can just forget any radical change of direction. It's as simple as that.
Elizabeth Foley.
Hello, I'm a professional officer at the Federal Office of the Australian Nursing Midwifery Federation, and our organisation nationally has around 270,000 nurses and midwives. They all have families, they all have friends, they have a huge voting reach in our society. I actually put 12 words down, Fiona. I took a leaf out of your book and went with both of the words. So I've got continuing collaboration of health professionals through CAHA because of solidarity and messaging and advocacy. And whilst our organisation is large and has taken a leadership role across the country, we have examples in particularly the larger branches where we've had, there's an educator in the Victorian branch. There are annual conferences around sustainability and health, and each year those conferences become larger and larger as more and more nurses and midwives are getting interested, are getting engaged, and are finding out what they can do in a practical sense in their own workplaces. So just getting back to the solidarity, even though we're large, we believe that there's real strength, and it's very important for us to participate in CAHA, to join with other health professional groups, because that's where our strength is. If we just go off as nurses and midwives giving our messages to politicians, if our medical colleagues, our allied health professional colleagues go off separately giving messages, then I think we can easily be divided and conquered. As health professionals across the board, we all need to be giving the same messages to the politicians.
Kath, since you're close to the microphone, and then Eliza, if you could take it over to Tim.
Lucky me, thank you. Well, something I'd like to input is, within a healthcare service, the role of accreditation and the statement of priorities are really important in driving change through our organisation. So there was a requirement in the statement of priorities. I think it was in 15-16 that was pulled out in 16-17. Was I think. Oh, good! Yay, go Tina! Fantastic.
18-19.
Good to hear. That really rattled cages in a positive way to have the discussion as, oh, what are we doing? Someone tell me what we're doing here. And often that came to nothing. We need to. So that's good. Accreditation also is a really strong driver for. And I think also the quality improvement framework is an opportunity to have this dialogue, getting those kind of voices in. How are we? I think making sustainability measurable in models of care, quality improvement. These really, getting it into our frameworks of measurement of progress in a positive direction, I think is really important.
Do you want to tell them how we tried to do that 2 or 3 years ago?
I was going to come back to that after Tim. Can we throw to you?
Oh no, you do it.
So the answer to the first question is pretty straightforward. Everything that's been said today sounds fantastic. Whether it's adaptation or mitigation, it's increasing awareness of people. That's going to inevitably increase the likelihood of political change, which is obviously what we're desperately after, as Peter said. But personally, I'll just endorse one of the things that was recently said on the basis that I'm in the Social Determinants of Health Alliance, and when we were discussing a couple of years ago what action we were going to do in terms of the Senate inquiry that was about 6 or 8 years ago, I can't remember now, on social determinants of health, that was tripartisan and was not even looked at seriously by either any of the parties. And the Social Determinants of Health Alliance was keeping on pushing that this should be answered by the parties. But anyway, I suggested, how wicked of me, that what we should be pushing must include climate change. And that was agreed to at the meeting. And then a few days later I received a phone call saying, well, we've kind of decided that we'd like to keep that out because it's going to be too difficult politically. So there we go. So my personal advocacy action will be to continue to get the Social Determinants of Health Alliance to consider that climate change is a pretty key social determinant.
Thank you. While the microphone is coming around, and Marion Cannon, I think you had your hand up. I'll just comment on the thing that Peter raised. We had an opportunity, or CAHA was invited to develop a draft standard for the Australian Commission on Quality and Safety in Healthcare a few years ago when they were doing a review of the standard. We thought it would be a perfect opportunity to embed climate resilience in the accreditation standards and the quality and safety standards for healthcare services across the country. So we set up a working group. We spent several months writing a background paper and developing a draft standard which never went any further. Perhaps all there is to say, but there's always room for more, so I'll circle back around to that in terms of a possible pathway forward. Marion Cannon. Oh, and we're... This will have to be it.
I suspect that Peter's right, and I have probably referred to government as one of my comments, but I think we need to also... Politics of division are never pleasant, and they have not taken most people anywhere much. I think we have to also send a message, and one of my goals is to get an article into the Murdoch press, is to say it's okay to be conservative and believe in and support mitigation, adaptation and climate change, because I think to write off a whole segment of the community who some of them are very powerful and have a huge voice, I will be dividing my efforts between spreading the word amongst the 30% who go either way based on evidence, and hopefully getting some traction in the conservative camp, not the deep conservative camp. Karen Phelps might help him.
Great. That's an excellent note to finish on. I really do need to wrap up because it is 11:30. I do want to, I've just taken some notes just then thinking about possible pathways forward that I wanted to share with you. I'm not going to have the opportunity to get feedback on them, but hopefully we can continue this dialogue because we are all in communication. But what I will do is just quickly sum up what I've heard, some of the opportunities that I see going forward for possible work for CAHA, ideally for others, is coordinating and convening work on the research agenda around climate change and health. Potentially there's a role in convening conversations on education, perhaps a working group so that there's coordinated action across institutions, across states, for getting climate change into health professional education across all disciplines. There's potential to do more work on supporting health professionals and health sector actors not just those who are clinicians, but people who work in the sector who also have a commitment to health and well-being, protecting and promoting health, supporting them to be effective communicators on climate change and health and communicating climate solutions. I think it's clear that it's important for us to bring the insights and perspectives of the sector to inform policy, but there's potentially a role, or there is a role, to help make it politically possible to develop policy to respond to that. Maybe there's an opportunity for training for health service executives and boards around whether it's about their legal responsibilities around litigation, but just their duty and fiduciary duty as for their institutions in recognising the climate change risk in their strategic and operational plans and operations. It's clearly useful for us to continue to support health services and share their stories, and for us all to do this, to share the stories of what is happening, to help accelerate a best practice around low carbon healthcare on our way to zero emissions healthcare. I think that, I'm not defeated by the failure that we had in terms of getting climate change resilience embedded in health sector accreditation frameworks. I think that should be an evolving conversation, and with capacity, I'd be keen to reopen that conversation. And just another one, whether there's picking up on the point that Michelle made, whether measuring air pollution, that was such a huge topic at the Global Climate Action Summit, really linking the burning of fossil fuels with climate change, but also the harm that burning fossil fuels do to us right now in a local and an immediate sense, can be such an important lever for driving the appetite and motivation for emission strategies, and whether there is potential for work around measuring the quality of air around hospitals and health services where people are going supposedly to be well, to communicate what that risk is, and then to be advocating for solutions. So we do need to wrap up. It's time for morning tea. You've all been very patient. We are going to, so we'd like to invite everybody to stay on for morning tea, and you're also welcome to stay for our Climate and Health Alliance meeting at 12 p.m, which is our CAHA annual general meeting, which will be followed by lunch at 1 p.m. So I would just like to thank you all for being here, thank our volunteers and staff, particularly Millie Burgess, who's played a big role in organising this event. And just to finish by saying, if you like what we do, we encourage you to join CAHA. You can join as an individual, friends of CAHA. If you're an organisation, or you can join as a member. You might like to donate to support our work, or get in touch, and I really encourage you to do all of these things, including get in touch to talk about how we can collaborate and partner on this work going forward. Thank you very much.